Hey everybody, this is Wayman Daniels from Level Up with my special guest, Matt Della Porta. Matt, how are you this evening?
Doing very well, Wayman. Thanks for having me.
Oh man, it's a pleasure to have you. So Matt, we're going to start out. Just tell us a little bit about you and your credentials.
Sure. So I first started studying psychology at the University of Rochester. I spent 4 years getting my undergraduate degree there. And then after that, I went to grad school at the University of California, Riverside, where I earned my PhD studying positive psychology. And
Positive
since
psychology.
then, I've been working as a business consultant for a number of years, helping businesses basically make their workplaces a better place to work so that, happy employees become productive employees.
Good point. Well, Matt, a question because I'm trying to understand what made you pick this field of psychology? What was it that tweaked your interest?
Yeah, I think the funny thing is I didn't even really study psychology at all in high school, but for whatever reason, I always thought I still wanted to study it. And it wasn't until I started learning about social and personality psychology, which
Mhm.
basically is a specific field of psychology that talks about, it asks really basic questions about like, well, why do people help one another? And
Mhm.
how come sometimes we're like biased in the way that we think about people and the way we judge situations. And it was like they were giving names and information about these things I had always thought of. And once that happened, it got me really interested and I wanted to keep learning more and more.
So it sounds like to me that there's a system to us liking people and judging people. Is some type of psych. Explain that just a little bit more because I never knew that.
Sure. Yeah. Well, I think a helpful way to think about it is really what psychology looks into is three different things. And they're easy to remember because it's just an A, B, and a C. It's the
Okay.
study of how people feel affect, which is just different kinds of emotions that you feel, also behaviors. And
Mm-hmm.
also a third one that's really important to keep in mind. C stands for cognition, and that's the way that we
Okay.
think. And there's a really interesting area of psychology called social cognition, which is basically how are the different ways that we view either a one on one relationship or a group setting or something like that. So, there's a number of instances where we're biased in the way that we think. I think like a very simple example would be something called diffusion of responsibility. And
Mm-hmm.
that's basically the idea that if you're working together in a group, unless you specifically ask somebody, hey, you need to do this particular task, we have a tendency to want to just offload that and assume that somebody else is going to do it. But if everybody assumes that someone else is going to do the work, nothing
Mm-hmm.
happens. And that can even have an application for an emergency situation. If someone
Mm-hmm.
needs medical attention, diffusion of responsibility teaches us that instead of yelling out, hey, somebody call an ambulance, you
Mm-hmm.
point to somebody in particular and say, you call an ambulance, and it's more likely to happen more quickly.
Now, when you say that we tend to, because I can think of a phobia of
Mm-hmm.
a person who's afraid to take charge or a person who doesn't want to take responsibility. They have an abnormal fear and they will
Yeah.
shun the responsibility to someone else. Is that some type of thing that's dealing with the mindset as well as the psychosocial?
Sure. Yeah. There might be people who get very nervous being put on the spot like that.
Mm-hmm.
And yeah, that could be a big factor. It's funny you bring up phobias because that's I know one of the things that we wanted to talk about today. And I think there's a lot of interesting information out there about phobias. And one, like you said, one way to think about it is it's a fear specifically of like one thing,
Mm-hmm.
but your fear is out of proportion to what's actually going on. So
Right.
somebody who maybe has a phobia of coming through and helping somebody like you're talking about, they will have more fear than is really appropriate for that particular situation.
Well, here, let's talk about because Matt, as a child, and can these phobias be a learned behavior dealing with certain, say, groups? Because I had a bibliophobia as a child because my neighborhood didn't want, when I say my neighborhood, my peers put out the
Mhm.
appearance of not wanting to learn.
Mm,
You don't need to read, you don't need to do that. So I had a very abnormal fear of books because I always thought I wasn't smart enough because it was a learned behavior. Now,
yeah.
can some of these phobias be learned behaviors?
Oh, yeah. I think in most cases, phobias turn out to be learned behaviors because really the only other alternative, if it's not a learned behavior, it might have some sort of genetic basis to it.
Okay.
But I would say in general, most phobias are learned experiences, like you said.
Mhm.
So that, like you were saying, it's a function of how you grew up, what your peer groups
Right.
were like. A lot of times, a phobia might be rooted in like one particular traumatic experience that gets you really
Okay.
nervous about a particular thing. So, yeah, overall learned experiences.
Okay, because I was like, but then again, once I learned that there's nothing to fear about reading books, I'm an avid book reader now. So I got over that once I got over
Mhm,
older. And so now when we talk about psychology, the
mhm.
definition is solving problems in human and animal behavior. So explain that just a little bit more and touch a lot more on the animal behavior. What does animal behavior have to do with psychology for humans?
Yeah, good question. So yeah, I like this definition of psychology. Like I mentioned, it could have to do with studying emotions, behavior, or the way we
Hmm.
think. Uh, but I do think it's very important to think specifically about behaviors. And
Hmm.
yeah, the study of animal behavior. Well, actually, there's quite a bit of research that tells us something about human psychology that's based on animals. So, for example, there's
Okay.
a lot of studies that are done with mice, and a lot of
Hmm.
what we learn about cognition has to do with like can a mouse navigate a maze properly, and what makes that mouse better and better able to learn that maze. There's a famous study about attachment from a child to their parent. That then this was a study that they did with monkeys, and what they found was that the
Hmm.
monkeys were very much close to a kind of stick figure of a mother who was giving them enough to eat, and a stick
Hmm.
figure of a mother who had nothing to eat but provided some sort of like softness and warmth. And up to that
Hmm.
point, they thought, oh, the monkeys will only be interested in the mom who gives them something to eat. But it turns out that the
Right.
monkeys also wanted just pure comfort and love. And
Mhm.
that's what they use to say, hey, human beings might be the same way too. It's not just about what can you do for me, it's about just feeling that loving connection with your parent.
Wow, you said a lot there because you said sometimes we don't want the things that you can provide on the external, but
Mm-hmm.
sometimes we want that emotional support because that means so much. And I want to touch on this subject because we do, and I know we're dealing with psychology, but talk about sometimes stop this in our community and what's wrong with our community. And I'm thinking that maybe they're not getting that parental touch that they really desire. So they go outside and do other things. But we're not going to go there because we know we're going to deal with the psychology part. And so Matt, when we talk about this thing called mental illness disorders,
Mm-hmm.
can you give us a definition and define that, break it down just a little bit more for us?
Yeah, absolutely. Well, in general, that's a good term to think in terms of is psychological disorders. So the general definition that I think is helpful for most folks is basically that a psychological disorder is anything that interferes with your ability to function in day-to-day life.
Hmm.
And once again, it's helpful to think of those ABCs in terms of, well, what um, kind of impairments to your functioning can you have? A psychological
Hmm.
disorder might impair your functioning emotionally. If you have major depressive disorder, for example, you're going to find it really hard to get out of bed in the morning sometimes.
Hmm.
Uh, as we talked about, certain phobias are going to really affect you behaviorally, and maybe even affect where you go when you go out of the house on a given day. And, I know I got to stay in this particular kind of situation, not this kind. And
Hmm.
another big one is I think a lot of people identify with some sort of feeling of anxiety. And
Yes.
anxiety disorders will really interfere with your ability to think clearly and make kind of
Hmm.
rational decisions and judgments about situations. People who struggle with anxiety have a tendency to kind of overestimate how stressful a situation is. So yeah, I think that's a good way to think of psychological disorders. Is really it's about how that particular disorder really basically messes up your day and gives
Yeah.
you a difficult time in living out your everyday life.
So it affects your mood. So
Mhm.
when you say it affects your mood, is it
Mhm.
a negative effect or is it a positive effect for your mood? Can it go both ways or is it just one dimensional in order for it to be diagnosed as depression or
Yeah,
something of that
that's a
nature?
great question. So in general, I think most psychological disorders could be categorized as having a negative effect on your mood. But in the case of something like bipolar disorder, that is
Mhm.
one of the rare ones where actually it could have a overly positive effect on your mood.
Mhm.
Something like bipolar disorder, I think is some folks have a little bit of trouble understanding it because it depends on the person and what their particular diagnosis is. But bipolar
Mhm.
disorder, at least the first type of it, really has to do with a lot of elevated moods or what you would call manic episodes. So if
Okay.
and, folks might relate to this if you've ever known somebody with bipolar disorder, rather than
Mhm.
feeling really really depressed, they might
Mhm.
actually say something like, "Hey, I'm thinking about moving across the country," or "I think I'm going to do this now," or they're going to have like very kind of grandiose ideas. They're probably going to feel like very kind of fidgety. They're more
Mhm.
likely to engage in risky behaviors, and they're not going to be sleeping
Mhm.
very much. So to answer your question, yeah, something like bipolar disorder, the part of the problem, at least with type 1 bipolar disorder, is it's actually elevating your mood to the point of impairing your ability to make good choices and judgments.
Okay, so it affects the mind, it affects your moods, and it affects your feelings, and it
Mhm.
affects the thinking process. Okay, but when you say behavior, are you talking about the way one acts or conducts oneself, especially towards others? So, what type of disorder would that be that you start to act a certain way towards others? Would that be bipolar, or would that be schizophrenia?
Oh, it could be all different kinds of things. When we're
Mhm.
talking about behavior, really, it's anything that you're actually doing that doesn't have to do with like internal thoughts or internal feelings. So
Mhm.
behavior could range anywhere from you grab a piece of fruit to eat. It could have
Mhm.
to do with all kinds of relationship behaviors.
Mhm.
So yeah, behavior is kind of like a big umbrella term to talk about any sorts of things that we're doing, whether we're by ourselves or one on one with somebody or in a large group.
Okay, so Matt, talking about these disorders, we talked about bipolar, phobias, anxiety, and major depression.
Mhm.
Now, let's break down anxiety just a little bit more. What are the signs of having anxiety or major anxiety and depression? So people would know what to look out for and who to talk to their primary care doctor about.
Yeah, and I'm glad you're bringing up anxiety and depression because
Hmm.
these are by far two of the most kind of common ways that people experience
Hmm.
psychological disorders. And wait a minute, it might be helpful before we dive into anxiety or
Hmm.
depression. When we think about psychological disorders, a lot of times it can feel like, well, you're either diagnosed with a psychological disorder or you're normal. And that's really
Okay.
not a helpful way to think about psychological disorders. One way to think about it that I think is really helpful is really like think of it in terms of like a teeter totter, and depending on every single person has like sort of like a balance in terms of like, are you having a lot of disorder in your daily life because of a psychological disorder? Are you more kind of neutral? Or are you like a highly healthy psychologically person? And so
Hmm.
when we talk about something like anxiety, it's not a question of like, oh, do you have an anxiety disorder or not? But it's more in terms of like, well, how do you think about that balance in your life? Like, are you someone who's kind of nervous a little some of the time, but not really? Or yeah, I tend to have kind of like certain situations I'm not comfortable in. Or oh yeah, anxiety is like a major problem for me, and it affects me like every day of my life. So with that said, you asked about some of the
Hmm.
symptoms. It would be a lot of feelings of worry, you'll feel a lot of physical symptoms. It's not just the cognitive part of like, you're fixating on the future and you're worrying about this, you're worrying about that. A lot of the physical symptoms can be pretty upsetting as well. You'll find a lot of people have a tightening in their chest. It's going to interfere with their ability to digest food. They might have some problems with their stomach and relieving themselves in the bathroom. It's going to affect your sleep. It's going to be a lot of different things that are potentially going to affect you with anxiety.
Mm-hmm. Hey, so let's talk about panic attacks, because panic attacks are associated with anxiety. What's the difference between panic attacks and anxiety?
Yeah, great question. A panic disorder is actually just one of many types of anxiety disorder. So, actually, something else we
Mm-hmm.
already talked about is technically an anxiety disorder as well, which is having a phobia.
Mm-hmm.
So, if it's useful, I actually have the list of 5 anxiety disorders in front of me because I wanted to be prepared for this
Mm-hmm.
conversation. So the 5 types are: you could have a phobia, you could also have panic disorder, you could also
Mm-hmm.
have more of a generalized anxiety disorder where you're just feeling upset and worried about things in general, and you can't even put a finger on what's particularly
Mm-hmm.
making you upset. There's also a social anxiety disorder, so people that feel really uncomfortable in crowds and at parties and more kind of like lively social situations. And there's also agoraphobia, where that's where someone is having a difficult time with a fear of being in a situation that they can't escape from. So, yeah,
Mm-hmm.
panic
So
disorders are many anxiety
well,
disorders.
let me ask you, here's a question too, because a lot of men, when they go into restaurants or places where there's a crowd, they
Mm.
don't like their back to the door. Would that be a sign of anxiety?
Yeah, I think there's a few different explanations for that. I guess think of it this way: is like if that's a compulsion where
Mm-hmm.
you refuse to sit in a restaurant unless you can face the door. Yeah, I would
Right.
say that's getting a little bit more toward the end of maybe a warning sign of a psychological disorder.
Right.
There could, like we talked about, learned experiences before.
Mm-hmm.
Maybe it's just a function of like, listen, I've had a life where it's beneficial for me to be able to face the door and
Right.
know who's coming and going.
Yeah.
So that could be a part of it too. And you're asking about like symptoms of anxiety disorders, and that's I think another thing I just want to make sure I say is that it's definitely helpful to talk about psychological
Mm-hmm.
disorders and what the symptoms are and what the types are. I myself would never feel comfortable diagnosing somebody with
Right.
a
Right.
psychological disorder, even if I met
Mm-hmm.
them, because I'm not a trained professional.
Right.
Um, you know,
Okay.
that, so there's even though I got my PhD,
Mm-hmm.
I did not train specifically to be a clinical psychologist, and that's
Right.
someone who specializes in sitting down with somebody, learning about them, and giving them a diagnosis. But for the purpose of our conversation, it's fine to kind of
Mm-hmm.
think a little bit in terms of what might be some warning signs.
Yeah, because this is very enlightening, and it's very informative. A lot of people don't know this. So I'm glad that we're having this discussion, because I'm looking up major depression
Hmm.
is a persistently depressed mood and long-term loss of pleasure and interest in life. I find a lot of my peers are dealing with this. The things that they used to love to do,
Hmm.
they no longer want to do, but stay in the house. They do exclusion versus inclusion.
Yeah.
And they just want to stay in the house, don't want to go anywhere, they don't want any company, and they don't want to be bothered. They lost a lot of the interest. Could these be signs of major depression?
Yeah, I think you described it pretty well.
Mhm. Okay.
Those I think are definitely a few warning signs.
Mhm.
If you're losing interest in the things that used to give you a lot of enjoyment, definitely a sign. If you find yourself
Mhm.
kind of holding up and not wanting to socialize very much, I mentioned
Mhm.
before, something like major depressive disorder can
Mhm.
really affect your sleep, and both ways actually. Some people with it have a hard time sleeping. Other people
Right.
might be sleeping several hours more than they're used to and spending a lot of time
Mhm.
in bed. So yeah, those, and it's sad to say, but yeah, I agree that I have people in my life as well who
Mhm.
seem to be suffering from this. And, something like depression and anxiety, I think, accounts for a ton of people. And I hope for your listeners, that's something that's hopeful to hear
Hmm.
is, if you're learning more and more about anxiety and depression and you're thinking, man, that kind of describes me, no, you're not alone. These are very,
Right.
very common problems that people have.
Well, you know what? When I talk about this because it's very personal for me. Major depression, major anxiety,
Yeah.
um, diagnosed with multiple personalities and such. But another topic we're going to get into was PTSD, which I got from the military, post
Oh,
traumatic stress syndrome. And let's talk about that because now there's different levels of post traumatic stress syndrome.
mhm.
So we can talk about it from, let's just say, a social PTSD from being in a social environment that's has negative effect on you.
Yeah.
A lot of people might be dealing with sexual assaults or physical assaults, et cetera, military assaults and of being in the military. Let's talk about that and the signs of that. How can you tell how can you, well, let's just break down PTSD.
Sure. Yeah,
Hmm.
I think that was a very helpful start. What you were laying out, which is there's actually quite a few different sources. Think of PTSD as it stems from a traumatic experience of some sort,
Okay.
and a lot of times, someone with PTSD will be able to point back to one
Hmm.
or many specific memories that they have that kind of they can tell. Okay, this is why I'm struggling with this disorder. Um,
Hmm.
you know, uh, PTSD is very often associated with military veterans, and for good reason, because that's a very common
Yes.
issue with
Hmm.
military veterans. Um, what's interesting to note, though, is that actually one of the riskiest types of trauma that people go through that makes them more likely to develop PTSD is something you already
Hmm.
mentioned, which is intimate partner or sexual violence of some sort.
Hmm.
That
Okay.
is number one risk factor of developing PTSD. So when we think of PTSD, a lot of times it might be helpful not only to think of a military veteran, but also,
Mhm.
unfortunately, a lot of women are going to be identifying more with the issue of some sort of relational violence in their past.
Mhm.
Uh, in terms of like actual symptoms, there's going to be a lot of things. It's going to be, I mentioned earlier, like really what psychological disorders come down to is how much they impair your ability to function in everyday life. And PTSD is one
Mhm.
of those where there's major impairment. There's nightmares. There's a lot of difficulties with thinking clearly. There could be flashbacks to that. There could be environmental things that kind of cue a flashback to that traumatic memory. And you're unfortunately something like PTSD is highly correlated with risks of suicide as well. So it's a very, very serious disorder.
So a lot of folks dealing with PTSD, I noticed that people are afraid to be vulnerable
Yeah,
and afraid trust. They have a lot of trust issues, and I'm talking from a personal experience from being in the military.
yeah,
I had to struggle with that trust issues, love issues, and was afraid and didn't trust anybody.
mm,
So what do you do for that cycle? Well, we know we need treatment, but
yeah.
other people are dealing with these same type of things where they don't trust. They're dealing with fear. Now, with that PTSD, would also that contribute to also having a phobia of fear, of afraid to love and show affection and trust people?
Yeah, that man, that's a great way to put it. I wouldn't necessarily say it would become like a phobia, but I would say a
Mhm.
very common symptom of PTSD would be
Okay.
a lack of trust in other
Hmm.
people. And that's why actually people who get treated for PTSD find a lot of benefits from group therapy, especially if
Hmm.
it's a group of people that have been through a very similar experience. So, that's what like something like the Veterans Association can provide a group setting for multiple
Right.
military veterans,
Hmm.
or again, similarly, if you're a victim of some sort of sexual abuse in the past,
Hmm.
it can be really, really helpful to have a room full of fellow abuse survivors. But
Okay.
yeah, not everybody's that way, though. Some people might really benefit from a one-on-one clinician relationship where you're just seeing
Mhm.
somebody who learns your story and is able to help you walk through it. But yeah, to answer your question, it would in a lot of cases be difficult because the persistent thought for someone with PTSD, among many other things, is people just don't understand what I'm going through, and
Okay.
that's extremely isolating.
So, Matt, we're talking about PTSD, post-traumatic stress syndrome, and also you can tell also it affects your concentration, but it also makes you irritable. Why
Sure.
does it make you irritable and it affects your concentration?
Yeah, a good way to think about something like PTSD is I'm going to get a little technical here, but I think this is
Okay.
worth thinking about. Um, each of us has a nervous system, and that can be
Hmm.
broken down into a parasympathetic nervous system and a sympathetic nervous system. The problem with something like PTSD is that it activates your what's called your sympathetic nervous system, which is
Okay.
basically the parts of your body that are in charge of responding to threats. So, if you
Hmm.
take like thousands and thousands of years ago when human beings were hunters and gatherers mostly, the sympathetic nervous system would alert you if,
Hmm.
say, there's a predator that's after you, or your sympathetic nervous system would tell you when you're in danger, or when you need to run, or when you need to do something to keep yourself alive. The problem
Hmm.
like PTSD is it's like it's ringing that alarm bell in your sympathetic nervous system, but it never gets turned off.
Okay.
So
Okay. So,
that
okay.
yeah, you're basically like you're in fight or flight mode all the time.
Right. Hmm.
So and hopefully that can explain how somebody who's in that sort of state all the time
Hmm.
starts to feel very irritable and like, whoa, man, life is just a huge struggle right now because it's just
Right. Right.
it's basically it's agony to be in that state. You can't relax. You can't just
Right.
lay
So
there
you.
and chill out.
Mhm. So you're always on alert. Now
Yeah.
we got one more, and it's this flat effect. Can you tell me more about that? What is the flat effect?
Yeah, flat affect is basically a different way of saying that you just feel emotionally flat or
Hmm.
neutral, and that's part of the problem with PTSD actually as well. Is that part of what makes it so difficult to live with is that you basically almost forget what it's like to feel good.
Hmm.
If you're either doing very poorly or if you're maintaining okay, you feel just flat. You feel
Okay.
like I just don't know how to enjoy life anymore, and you start to have thoughts like that, which can be again very alienating and make
Mhm.
you really start to question, what am I doing here? This is awful.
So okay, Matt. So when I think about flat effect, I'm also it makes me think about becoming callous to life, where you just become so hard. You just don't want to be emotionally involved with anything. You just get so shut. You shut everything off that you don't want to feel anything because of the trauma and
Yeah.
everything that you've been through. Um, that's I had to deal with that a lot because I even had to have a lot of psychological help through the VA to deal with the PTSD, to deal with the major depression, to deal with the major anxiety, and it took a lot of work. So before we go, what would be your golden nugget to leave our viewers?
Yeah, a couple things. Number one, I think if you or somebody you think maybe should see somebody professionally because you think they might have some sort of psychological disorder, a couple things are helpful. Number one is finding a therapist. And
Hmm.
one way to think about a therapist is think of it like you're dating, right? You're
Hmm.
not going
Hmm.
to marry the first person you go on a date with, and that's the way you should treat therapists. If you, I hopefully you have a choice of multiple people you can see, and you try one. If you sit down and you're like, what, this is not a good fit, you'll know
Right.
based on if after you've sat down with them for whatever, like 30-40 minutes. Try somebody else. I think a big mistake a lot of people make is that maybe they try it once, they have a bad experience with a therapist
Hmm.
who's not a good fit, and instead of saying, okay, well, I better go try find somebody else, they'll say, well, all right, therapy's not for me. So
Right,
that's
right.
the first thing, is that uh, treat that like, okay, I'm shopping around if you
Hmm.
can. Ideally,
Okay.
that's the way to approach it. Second piece of advice would be, there's a pretty big stigma regarding, oh, do I need to go on medication or not? And
Right.
that's kind of a whole other conversation. But I do think it's important to touch on, because in a lot of cases, what can really help somebody with a psychological disorder is medication.
Right.
But the caveat with that is, in my opinion, and I think the research bears this out, it almost never should you treat a psychological disorder only with medication. A
Right.
lot
Right.
of times, what medication can do is first of all, it'll help make your symptoms way more manageable. It'll
Hmm.
kind of
Hmm.
bring all the levels down to a point where, like, okay, I can deal with this. This is better than it was before. And secondly, what it'll do is a lot of times the research shows that actually a combination of therapy and medication can be very,
Hmm.
very effective for people. So think of medication sort of as a complement to therapy if your professional decides that might be a good choice for you.
Hmm.
Um, but yeah, I think I'm becoming kind of more and more uh, an advocate for that sort of thing, because a lot of people, I think, it's scary for a lot
Hmm.
of people thinking about
Right.
going on medication, and you might start to think like, oh, what's it going to do to me?
Hmm.
Um, but I don't mind sharing that I'm on medication for anxiety and depression, and I found it to be extremely helpful.
Hmm.
And it helped me seek the help that I need, but it made my symptoms much more manageable and allowed me
Manageable.
to get the help that I needed.
Matt, you took me to a whole nother thought, but I'm not going to get into that thought of self-medicating and all that other stuff because that'll take us another 20 minutes.
Yeah.
But if you can, briefly, for like maybe I'll give it another 5 minutes to talk about the self-medicating, because a lot of people, when they're dealing with these symptoms of certain things, but they don't know that they have these mental illnesses, and so they self-medicate either through drugs, alcohol, sex, etc., etc. And you said a mouthful by
Yeah.
seeking professional help. And that's the best way to go, to seek professional help and get diagnosed to find out what's actually going on versus self-medication with these really dangerous behaviors that can get you caught up into some other things. So that was very insightful. You want to talk on that briefly, or?
Yeah, I think one way I can say it pretty concisely is there's a huge difference between relief and
Hmm.
actual healing.
Okay.
And anybody really struggling with a psychological disorder, the goal ought to be some healing. And that's not to
Hmm.
say that, okay, if I just do exactly the right things, I don't have to deal with this anymore. But healing means that for the long term, you're better off and you're feeling better and you're better able to function. The problem with self medication, whether, like you said, it's like it could be almost anything. It can be, yeah,
Yeah.
the usual ones are
Hmm.
things like alcohol, drugs, sex. It could be TV,
Hmm.
be social
Right.
media, it can be food,
Hmm. Yes.
all kinds of things become addictive because they provide just temporary relief. And that can
Hmm.
be really, really tempting because it works,
Right.
it works on command. But I think we all would admit it's not like it's a long-term solution, right?
Right.
And
Okay.
that's the difference between actual healing and just temporary
Mhm.
relief.
Well, Matt, I certainly appreciate you coming to Level Up and giving us this great information. Thank
Yeah.
you for coming. My name is Wayman Daniels. Thank you for watching Level Up. Next week's guest will be Savon Holt, life coach and author. She's an entrepreneur. Again, next week's guest will be Savon Holt, life coach, author, and entrepreneur. Look forward to seeing you guys next week. Thank you, Matt. Have a great weekend and day.
You too, Wayman. Thanks very much.
You're welcome.